Hi there, I'm Dr. Mark Poray, a sports and family chiropractor in Brooklyn, Ontario, and I've been in practice for 30 years. Today I'd like to talk to you a little bit about conditions that chiropractic has actually been shown to help, scientifically shown to help, those where the results are not completely conclusive, and those where it does not help at all. Now, the basis of scientific proof lies in the setup of the studies. In recent years, a new criteria which lays out very strict guidelines for these studies has created a definitive guide which researchers must follow, including such things as background research, possible conflicts of interest, as well as the degree to which these results are acceptable or unacceptable, and things like side effects. These guidelines are called the Cochrane Library Guidelines, and the results I want to discuss today were the result of a study that followed these protocols. So, some patients have actually asked me whether or not chiropractic can help these conditions, and may have been told by their personal health practitioner that they should either not see a chiropractor, while others have been told that chiropractors can only help back pain. A few have been told or sent by well-informed doctors to seek out chiropractic care for an increasing number of conditions. Now, keep in mind that chiropractic care is no longer just cracking the neck. Chiropractors today rely on a number of joint mobilization techniques, soft tissue manipulations like myofascial release, as well as spinal joint and peripheral joint manipulations. The joint manipulations can be done manually or mechanically, and this avoids the cracking that some doctors are concerned about, and some patients as well. These techniques are supported by a number of physical therapy modalities like cold lasers, microcurrent, ultrasound, interferential current, kinesiotape, acupuncture, and so on. When you consult a chiropractor, they will normally choose the therapeutic model which they believe will get you the best results. Now, if you have concern, it's up to you to let the chiropractor know this. With that concern in mind, your chiropractor can then select an alternate approach. This is not dissimilar to your family doctor selecting an alternate medication when you let them know that you have had some side effects or are concerned about their choice. So, with that in mind, let's go over some of the things that chiropractic spinal manipulation has been shown to help. There's highly positive evidence for chronic low back pain, moderately positive evidence for acute low back pain, acute, subacute, and chronic neck pain. Now, the evidence for sciatica, coccydynia, and mid-back pain is favorable, but is somewhat inconclusive at this point. As I said earlier, chiropractors, especially sports chiros, treat peripheral joint problems. So there is currently moderate positive results supporting manipulation for shoulder girdle dysfunction, hip osteoarthritis, knee osteoarthritis, patellofemoral syndrome, and plantar fasciitis. There is favorable but inconclusive evidence to support manipulation for carpal tunnel syndrome, ankle sprains, Morton's neuroma, hallux limitus, and hallux abducto valgus. Probably the most controversial area is whether or not spinal manipulation helps in non-musculoskeletal conditions. There's moderately negative evidence for supporting the treatment of asthma, but inconclusive but favorable support for the treatment of stage 1 hypertension. Moderately negative results for dysmenorrhea, and inconclusive and unclear results for the treatment of premenstrual syndrome, and moderately negative results for the treatment of colic. Now, there has been moderately favorable support for the treatment of nocturnal bedwetting. These are obviously for treating children. Finally, in the area of headaches, there is moderately positive results for the treatment of migraine headaches, cervicogenic headaches, and cervicogenic dizziness. There is also favorable but inconclusive support for the treatment of TMJ, while tension headaches seem to be inconclusive and unclear. There's a lot of information here that I've just given you, and if you would like the full report, you can access The Effectiveness of Manual Therapies, the UK report by Bomford, Haas, Evans, Leninger, and Triano. Thanks again for watching. I'm Dr. Mark Poray, and you can find more of my vlogs on other health subjects listed below here in my archives on my website at www.drporay.com.